Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You are tuning into our series In the Know, where we make it simple. Today we are simplifying strategies for answering questions on your registration exam.
Before we get started, I want you to know that we have something to offer. If you are writing the NCLEX, NCLEX-PN, or CPNRE exam, this will apply to all of our audience. And before we get started, we just invite you, as always, to subscribe to us if you're joining us on Facebook, or subscribe to us on our YouTube channel. That doesn't mean we'll inundate you, it just means you'll be notified when we put out new content, which is multiple times a week. You can also join us on our Facebook page at www.n-powermentnursing.com, where you can view our complete study packages as well as download our free trial, which is full access to our cardiac chapter. Do us a favor, comment below where you are joining us from, what exam it is that you're writing, and what you would like to see in future videos, and we would be happy to make that happen for you. So today we are talking about answering questions and strategies for success. In our complete course textbook, we do have a section on this. We use an acronym called STOP. This is obviously in more detail. We're going to simplify it down a little bit for you today for the purposes of our video. But Linda and I are going to go through this acronym and how you can use it while you write your registration exam to kind of pause for a moment, a strategy for actually having the question in front of you, and questions you can ask yourself to kind of get to the right answer. So, as I said, the acronym, or the mnemonic, however you want to think about it, is STOP. And the S in that acronym stands for simplify. In our experience with nurse graduates, I think we really realize what the most successful graduates do is they read the stem of a question and then they think about the stem of the question before they jump to the possible answers. So you need to simplify the stem of that question before you even look at the possible answers. So what we mean by simplify is asking yourself, okay, what is it that they want to know if I know? If you can answer that question, then you're reading the stem of the question appropriately. For example, if they ask you a question about, they give you a clinical situation of congestive heart failure, and these are the clinical manifestations of your patient, and what is the nurse going to do? What they are wanting to know, if you know, is, do you know what congestive heart failure looks like? Do you know the signs and symptoms of it? Do you know what nursing interventions would be employed for congestive heart failure? So you need to stop right there, simplify it, and maybe reframe the question to something that's more simple to your understanding before you even go into the different options in terms of the A, B, C, D, or the select all that apply, for those of you writing the NCLEX exam.
The T here stands for take a moment. Take a moment is about reading the stem of the question and relaxing, pausing, thinking about your content, going back to your content, not rushing to the answers. It's very important to really look at the stem and understand it and relax and think. And this is what take a moment represents.
The O in the STOP stands for order it. And this is pretty specific for those prioritization type questions. Not every question is going to be a prioritization type question. Those are higher level, more difficult application type questions. But if you get a prioritization question, you can recognize that with phrases such as, what would the nurse do first? What would the nurse do next? What would the priority action of the nurse be? That's kind of basically where prioritization questions go towards. So here's some questions you can ask yourself when you're trying to come up with the right answer. Kind of 4 things here you could ask yourself. The first one, assessment always comes before implementation, remembering that depends if the question requires more further assessment. In emergent circumstances, things do not require further assessment if you need to phone the physician right now. Number 2, you can think about Maslow's hierarchy. Safety, love, belonging, esteem, self-actualization is kind of how that goes from the bottom to the top. So sometimes you can use Maslow to come to the right answer. Number 3, physical comes before psychosocial. So those are the rules around the registration exam because it's a safety-focused exam. And lastly, ABC, airway, breathing, circulation. But we caution you not to fully rely on that, because if the stem of the question doesn't involve the airway, it's not going to be the right answer. So don't think that's just a golden, if airway is an option, you're going to choose it. You have to critically think as well.
And P stands for pick it. Now that you're ready to pick what isn't right, so rule out all of the wrong answers, right? So take those off your list as incorrect to narrow it down. Then think about which one helps the patient right now, is the safest answer. If you could do one thing only, what would you do? And these are kind of the questions that you want to reflect on as you pick it.
So we hope that this acronym, this STOP acronym of simplify, take a moment, order it, and pick it, will help you come to the right answer on your registration exam. Remembering, I know we hate to break it to you, this is always bad news to nurse graduates preparing to write the registration exam, but there are no tricks, okay? We have a lot of study tricks that help you remember stuff, but when you're answering questions, there is no trick out there that is going to replace actually knowing your content. And one of our favorite sayings that we like to remind all of our graduates of, yes, we're all studying to pass the registration exam, but at the end of the day, you will have somebody's life in your hands. So study like it.
If you are looking to gain all the content, critical thinking, and confidence you need to pass your registration exam, we have complete NCLEX, NCLEX-PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you for joining us. We'll see you next time on In the Know. Bye for now.